Mr. Posey, you're recognized.
Thank you very much, Mr. Chairman, and thank you so much for letting me participate in your committee today. Dr. Yeah, I hate to be redundant, but my concerns are very similar to those expressed by virtually every other member of the subcommittee. In my congressional district, we are already losing doctors because they've had such a bureaucratic nightmare trying to get paid. The physician's billing department is being told that it's something they did wrong, even when they make the required changes. It's as much as 5 months, and from what I've heard, my guys are lucky. It's only taken them 5 months to get paid. Can you tell me what's being done to shorten the time between billing and payment? And what I mean by that is, besides just saying this is what we're doing, can you tell me where it's been enacted, or if you've got rules that have changed that?
I don't want to sound like a broken record, but the biggest thing that we are talking about is coming in these next couple weeks, where we unlink the record from the payment. That, I think, is going to really speed up payment. And your district is in Florida,
East Central Florida, yeah.
Yeah, and Florida is dear to my heart because I grew up in Florida. I went to the University of Florida, and so I've read a lot of news articles about the hospital association and various challenges that Florida hospitals have been facing. Gene can describe a little bit about some of the work that we're doing with, specifically with some of the Florida providers to improve it.
Sir, some of the things that we're doing as part of this, as Dr. He had mentioned, the rapid response team, we have gone out and met with congressional staff members in local districts. We also work with hospital associations, state hospital associations, and we have been out to Florida, not in your district, but if you would like us to come out and talk to some of the hospitals, we'd be more than happy to do that. We provide a lot of provider education. We'll take cases back with us and start to work on claims. A lot of it centers in some of the accounts receivable, but you know, case in point, we spent a lot of time in Vision 16 in Louisiana and Arkansas, and we have seen some phenomenal changes, not only in terms of our paying our providers, but also working with our staff members. We pay in Vision, we call it Vision 16, Arkansas, Louisiana, about 96% of the time within 30 days of our claims, and we're just having phenomenal cooperation. By working with providers and their business staffs, it does make a difference, and we would do that for you too, sir.
Well, I would appreciate if you would come to our district and do that. Veterans who use Veterans Choice program, there are usually those in pain who can't wait for long periods of time, obviously, to get treatment. For instance, spinal surgery, knee, hip replacements, and things like that. Why are they getting paperwork authorizing the procedures that expire before, authorizing the procedures and care that expire before the paperwork is even generated?
On the authorization side, we've also made a change on that recently too, and that was, we gave an authorization out, it expired, it had a very short lifespan. That authorization was only good up to 60 days. Yeah. And that just didn't make a lot of sense to us. And with Dr. Hill, we talked about this when we created and drafted the plan that we presented to Congress in October, and we've extended that now in many, many cases up to a year.
Good, I'm glad to hear that. What percentage of employees that handle veterans health care have a military service background?
The number's about 30%, a little over 30% of employees in Veterans Health Administration that are vets. In our claims department, it's over 50%.
You know, I mean, when we hear from y'all, it sounds like everything's going to be quickly headed toward roses, and of course y'all have been hearing that probably as long as you've been serving on this committee. But we get back in the districts, and then we seem to encounter claims people, for example, that don't seem quite frankly and simply to have much respect for our veterans. And I wonder if you've ever considered making prior military service a condition of employment, at least in those departments where it's point of service.
Let me take that. So I want to clarify one thing. We don't think this is a sprint. There's certain things that we have to get right today because there's such pain points, but we know this is going to be a journey to be able to get us to the ideal state where we want to be. I think what you're getting at is like military cultural competency, the training, and I think back to my medical training, and I never received anything specifically related to veteran or military cultural competency when I was trained to be a doctor. My only experiences were when I was a medical student working at the VA taking care of veterans that I actually gained that appreciation and that respect. I think we could do a lot better making sure that our community providers have access to that sort of training, and we're actually taking steps to do that. We have 4 courses that are available online. People can get CME, continuing medical education credit, to learn more about the uniquenesses and the nuances of military and veteran healthcare. And so I think I'd love to be able to share those links with folks on the committee so you guys can push them out to community providers.
My thought is
your community.
Just respect for the customer. So they don't get the fast foot shuffle and the razzle dazzle. And I mean, somebody is giving them authorizations that expired before they got the paperwork. Now, nobody who respects the veteran that they're there to serve would do something that's stupid. And so my thought is maybe the claims people that process the claims actually ought to not get some kind of sensitivity training. Maybe there ought to be a requirement that they've had military service, that they have some respect for the job.
I think, as Gene said, half of them have served. I'd love to talk to you a little bit more about that.
I'm sorry, Mr. Chairman, I went over. I apologize.